people become healthy and happy. On left hand side, you can see that the root cause of any non-communicable disorders is usually, indigestion, problem with stress, something with respect to genetic, poor digestion, nutrition, and so on. And then, when it is not solved, when it is imbalanced, it actually results into either hypertension or cancer or anxiety and so on. So the best thing about Ayurveda is it tries to find out the root cause. So can we really work on Ayurveda, get data, get the systems in place so that it becomes truly personalized. Whether you look different, whether you think different, you get what you want. Right? So the first system which we have developed is called Nadi Pariksha. It's based on pulse analysis. Very much, pulse is the agenda of this conference. It's a very age-old science based on the Guru Shishya Parampara, tries to find out the Vata, Kapha, the Agni, the Bala, and so on. And precisely what we have done is come up with a system which mimics the Ayurveda method of Nadi Pariksha. So it's a pressure sensor system which picks up the pulsations and gives a report card.
Place the patient's hand on the handrest. Now, place the sensor on the wrist as shown and capture the Nadi patterns for a minimum of 1.5 minutes. If the app shows regular, rhythmic BPK patterns, you are using the device correctly. The presence of a red overlay on the graphs indicates that the patterns are not rhythmic. This shows the complete 10-second graph of all three signals: Vata, Pitta, and Kapha. Blue is Vata, red is Pitta, and green is Kapha. The same composite graph is shown as 3 individual patterns. This is a single Nadi beat benchmarked against the average healthy graph for that dosha. This is the report with all key parameters and reference ranges for easy interpretation. Detailed diet recommendations based on your Vikruti are provided, with do's and don'ts for each food type. You can modify this basis your diagnosis. Add your prescription.
So as you see that the manual Nadi Pariksha has become digital, and you get report cards which talks about digestion, which talks about stress, which talks about hydration and so on. And it gives a completely personalized diet and lifestyle guidance. It talks about aromas, panchakarmas, music and so on. Very quickly in next 3 slides I'm going to show you how we proved how food works as medicine. We did pre and post, Vata provoking, Pitta provoking, Kapha provoking food items. We showed how Surya Namaskar increased the Bala inside the body. We showed during various Panchakarma treatments how our body really reacts, how the Krishnata Guna goes down. We tracked about 25,000 people across the Hindu calendar, and we showed that during Shukla Paksha, our digestion is better. During Krishna Paksha, it's lower. If you track the Pitta line, it goes up, comes down on Ekadashi, comes down on Ekadashi and so on. These are 25,000 people across India. We showed that how diabetes can be monitored non-invasively just through Nadi Pariksha. So we are working on a sensor which, instead of pricking the blood, if we can create, which completely solves non-invasive. So the whole world where the issues are more metabolic, mental related, fitness related, wellness related, if we can create a completely integrative system based on Ayurveda and modern medicine, I think that is what is required. From Maharashtra point of view, from government point of view, our product has already got accepted by the board of NCSN to teach Nadi at the college level. So we are already operational at 100 colleges, 400 more to go. Got a couple of grants to do clinical validations, proving how Ayurveda and modern medicine can work together and so on. But it's just a start. And I think more people, more grants, more colleges, more institutes should come together to find out how the modern medicine and Ayurveda, both of them can talk to each other, come closer, so that we can really give a bigger, better system to the world. Very quickly, just to summarize, yoga has got accepted worldwide, and I think all people who are doing yoga right now across the world will move to Ayurveda very soon in next 2 to 5 years, but it has to be given to them in the most technology way. The numbers, the reports, patents, publications, comparisons and so on. and I think we have found a solution. It's just that we need more research, we need more people coming together so that we solve the problem. Thank you so much.